Hi there, and welcome to installment 14 of Achieve Wellbeing. I'm Dr. Lisa Kirk Brown, Doctor of Public Health with almost 30 years of experience in preventive medicine, retired Air Force Lieutenant Colonel, and disabled American veteran. Today I want to talk about mindfulness, the first element in the spiritual aspects of well-being. Last installment we introduced what spirit is, what soul is, what psyche is, and today I really want to focus in on our spirit and how to keep that healthy. Sometimes when you walk around you see people and you can just tell they look a little dead inside. Maybe they're depressed, maybe they've had some tough times, and they've just been weighed down by the things in this world, which are increasingly more scary as time goes on. Sometimes you see someone and you just see joy in their face and in their eyes, and it's not something that you can quantify necessarily, but you can see it. It's a real thing. They have a glow about them, if you will. Those people, I think their spirit is alive. And I want to talk in these next few installments about how to get that serenity, peace, and joyful spirit. Today I want to talk about mindfulness. There's been a lot of information in the news lately and the catchphrase mindfulness. And so I'm going to try to break it down for you so that you can understand what it is and what the health benefits of mindfulness are. I want to talk about 3 different types of meditation or mindfulness. Mindfulness is really simply the practice of focusing on the present moment and developing an increased awareness of experiences as they happen. Mindfulness meditation is this practice. It's not to be confused with transcendental meditation, which is a technique for detaching oneself from anxiety and promoting harmony and self-realization by meditation, repetition of a mantra, and other yogic practices. So, transcendental meditation is really more about a mantra. Maybe you pick a word, joy, for example, and you just continually say that. It was developed out of Eastern, mainly Indian culture, the Hindu religion, if you will. And so I would like to talk about how both of these have found to have health benefits. Both have been found to lower blood pressure. Both have been found to reduce stress. Both have been found to slow aging, which is a nice thing. And both have been associated with reduced rate of heart attack, stroke, and death, ultimately death, reduced rates. So, or longevity, I guess you would call that. So what is the next type of meditation or mindfulness? We would call it prayer. So prayer is a solemn request for help or expression of thanks addressed to God or an object of worship. And prayer has also been shown to have significant health benefits. In triple-blind randomized controlled trials, similar benefits have been shown to mindfulness meditation and transcendental meditation. However, prayer has been found superior to secular meditation and relaxation in terms of decrease in anxiety, improvement in positive mood, spiritual experiences, and tolerance to pain. That was out of the Journal of Behavioral Medicine in 2005. Additionally, prayer may heal by divine intervention. This is scientifically proven in some studies. The Annual of Internal Medicine in 2000 reported the efficacy of distance healing showed health benefits from afar. So even if the person in the hospital doesn't know that you're praying for them, this trial in the Annuals of Internal Medicine showed that there was significant improvement in the person's overall demeanor, their positivity, their general well-being through the power of prayer. These effects don't focus on one religion, obviously. All major religions believe in prayer, believe in getting alone and taking time to acknowledge a creator and ask for his divine intervention, his or her divine intervention. The commonality between these is time alone and quiet contemplation. This is the commonality between mindfulness meditation, transcendental meditation, as well as prayer. Getting alone in quiet contemplation. Some people may call that boredom. As I told my kids when they were little, boredom is good for you. There are statistical studies, there is statistical evidence to prove that boredom is good for you. In today's busy, hectic world we live in, it's increasingly important to have this time to meditate and or pray, to stop thinking and focus on either one thing, nothing, or God, and be thankful for the good in the world. So the mantras would be positive rather than negative, such as healing, joy, praise, thankfulness, forgiveness, etc. All of these lead to serenity and peace, the polar opposites of stress and anxiety, which obviously is good for you. We've already talked about the negative consequences of a stressful life, how that can be detrimental to your health. So I want to read for you some of the positive benefits of this spiritual awareness, this time of prayer, mindfulness meditation, or transcendental meditation. And then I want to describe a little bit about how to do these things. Just a very, very smidgen, because there's so much information on all three of those aspects of mindfulness. So mindfulness has been proven to relieve anxiety and affect mood. That was out of a study in the Journal of Consulting and Clinical Psychology. Mindfulness may keep the brain young. That was out of Neuroimage. Mindfulness can lead to better decision making. The study conducted at Virginia Tech showed that people who practice mindfulness use different parts of their brains in the decision-making process. Mindfulness can change brain structure. It published in Neuroimaging, it revealed that an 8-week mindfulness training program makes measurable changes in brain structures associated with learning and memory, sense of self, empathy, and stress. Mindfulness reduces stress. We already talked about that. There's lots of information around that. Mindfulness increases the immune response, may give positive feelings and antibody responses to immune system challenges. Mindfulness enhances attention, mood, and memory. Wake Forest conducted a study that was published in Consciousness and Cognition that said it showed significant improvements in mood, visuospatial processing, working memory, and cognition. Finally, mindfulness reduces irritable bowel syndrome. A Swedish study showed a 50% reduction in 185 symptoms, as well as other positive outcomes. So how do you meditate and pray? How do you start practicing mindfulness, meditation, or prayer? I want to guide you through a practice, but there's so many excellent resources out there for you to turn to. Mrs. Mindfulness had a mindfulness summit last October that was excellent. She's online and has access to tons of resources in this vein. Mindful Magazine is now published, and it incorporates some of the modern results as well as techniques used for mindfulness. Oprah Magazine, had an amazing summary this month and actually gave some very helpful tips as to how to introduce these things into your practice, your daily life. Arianna Huffington of the Huffington Post has tons of information on her website. And then there's an NIH website. If you Google NIH mindfulness-based stress reduction, there's techniques featured for all types of conditions. There's 2 mind and body practices for chronic low back pain, better than usual care alone. There's mindfulness practices for acute respiratory infections, rheumatoid arthritis, ulcerative colitis, sleep disorders, and more. My very good friend, Dr. Huyn, which I hope to interview for this spiritual aspect, is a Buddhist. She actually incorporated mindfulness techniques for PTSD at Walter Reed and continues to do work in that vein. She's been on top of mindfulness for, gosh, probably 10 or 15 years because she's Buddhist. We connected because I believe in the power of prayer, the Christian prayer life that I have, and I've seen amazing results, miraculous results with that. So we combined and talk a lot about how to incorporate these things in healing and health methods. So how do you have to do this, and what does this look like, and how much time do you have to spend? We're all busy, you know, it's just one more thing to add to your plate. Maybe you don't want to do that. I understand. So I'm going to guide you through a short practice of mindfulness. And remember, you can incorporate transcendental meditation, which is a lot deeper, more removed from the self type of practice. You can practice mindfulness, which is being in the moment and understanding your body and what's going on in it. And then you can also practice prayer, which many religions are out there discuss that, and there's lots of resources online that you can turn to for that. Also, please remember, you can always contact me at Dr. Brown, Disabled Veteran at gmail.com, and I'd be super happy to talk to you about any of these aspects, these practices. They're called practices. Okay, so let's just start with a small practice. There's lots of things that are similar to this. Yoga Nidra is a really a great meditation practice that is online. You can YouTube Yoga Nidra. There's lots of self-help type of videos out there to get you in this mindset and to help you calm your nervous system, etc. I'm going to focus in on this practical step. Forget about going to a monastery. Forget about having to be in a really quiet place. You can meditate any time of day, anywhere, for as little as 10 minutes a day, even on a flight, even in the metro or at your desk. You can meditate. 10 minutes a day has been shown to have an impact. So what does that look like? All right, let's start. Just sit comfortably, upright on a chair, feet on the floor, hands resting on your thighs. So follow me in this practice, and I'll walk you through it. So you put your feet, take 2 or 3 deep breaths, and then close your eyes. So close your eyes. I'm not going to do the exact practice. I'm going to read it to you, but your eyes should be closed now. Starting from the top of your head and moving down, mentally scan your body, noticing any tension in your muscles, places of comfort or discomfort, the feel of the floor beneath your feet. Begin to pay attention to the natural rhythm of your breath. As you become more aware of your breath, follow the rising and falling sensation without changing it in any way, silently counting breaths. Inevitably, your mind will wander. This is one of the first lessons of meditation. When you notice that a thought has distracted you, let go of it and gently return your attention to your breath. Over time, you'll learn to step back and just observe the thoughts. The same goes for sounds. Rather than trying to block them out, let them come and go. Take a few seconds to allow your mind to do whatever it wants. You may find your mind is very quiet. Noticing the sounds around you and bringing your attention back to the body, gently open your eyes. That's it. That's all you got to do. You can take this further. You can focus on any tension in your body. You can stay there. You can sit with it. You can focus on any thoughts that you're having, and you can incorporate some prayer around those thoughts. My son is getting married on Friday, and I'm so excited for it. And I'm just have such joy at this love that he's found in his life. And those thoughts come up of love and joy, and I can sit with those and really feel them and take them in. The same is true of negative thoughts. Maybe the pain that you're experiencing, or the emotional struggle that you have, or maybe you're worried. You can sit with those emotions and really delve into them. And as you do that, letting them go, releasing them, can be healing in and of itself. Many people meditate first thing in the morning to start the day, but everybody's different. So find what works for you. How often? The more you practice, the more quickly you'll see the benefits, but quality matters more than quantity. So focus on little and often, taking the time to build a strong foundation. If every day feels too much at first, start with 3 to 5 times a week. How long? For beginners, just 10 minutes a day will suffice. Using a timer and an app, for some people, that will always be enough, but eventually you may decide to sit for longer periods of time. I've heard of people sitting for an hour, and it really helps to give them more ability to be in the moment throughout their day and throughout their life. Lots of workplaces are incorporating this into their actual workday. Many successful business leaders are incorporating this into their work life. There's lots of information online. There are apps for your phone. One is called Calm. There's some yoga apps. Shavasana is the ending rest period of yoga, which is similar to this, where yoga nidra could be applied. There's lots of resources out there for you to get attention to. And what I want to do is encourage you to practice some type of spiritual awareness. I'm not expecting you to be religious in any shape or form, although I do want to really emphasize that the statistics and the medical research around prayer versus secular methods of meditation shows that the spiritual mechanism is a little bit more effective at healing. So thank you so much for watching. I look forward to next time meeting with you on relationships and emotion. And thank you so much for watching. I look forward to hearing from you and hearing about all the positive things that are happening with your journey on mindfulness. Thanks, and have a great day.